And welcome back, everybody. Ed Whitfield joins us, 1st District Congressman from the great Commonwealth of Kentucky. Welcome back. Been a while since we've been here.
Well, it has, Eddie, and thanks for giving me the opportunity to be here.
What have you been doing? Well, I say that facetiously. Congress has been pretty busy lately. I guess the health care is the big issue. The vote last week, of course, you were a nay vote on that,
Wow.
as were all but one of your Republican colleagues. By the way, what about that little guy that voted for it? Was that a big surprise to?
Not really. He's from New Orleans, and he represents a district that's about 75% Democrat, and I really didn't talk to him about it, but I heard him make a comment that the majority of people in his district were in favor of it.
Okay.
So
All right.
that's what he did.
Well, let's talk about it. Right now, the House bill has passed,
Right.
and I know you have made comments that, as your party is, and as you are personally, don't believe in this. And can you just kind of lay out why you say that?
Well, first of all, within the framework of where we are today, with the economy being as weak as it is, unemployment being as high as it is, and our efforts to stimulate the economy, one of the reasons that I'm opposed to the health care bill is that I think it would have a negative impact on our ability to stimulate the economy because of the additional cost it would put on businesses, particularly small businesses, and they create 2 out of every 3 jobs created in the country today. So that's one reason, the negative impact on the economy. Second reason is just the facts of the bill, what's contained in the bill. First of all, it establishes a national health care board, and it's very nebulous about the powers of this board. And we know that anytime you have nebulous powers, you're able to assume a lot of powers, and so anyone even selling health insurance would have to meet the requirements of this board. Second of all, it takes $400 billion out of Medicare, the healthcare system that our seniors depend upon.
Mm-hmm.
It takes $123 billion out of Medicare Advantage, and we have 10,000 people in the 1st District of Kentucky that have that as their health care plan. It takes $155 billion out of the hospitals. And they're taking that money in an effort to use that money to pay for the public option. But since that's not enough money, they're also this bill institutes a tax on individuals whose income is above a certain level. It also puts an 8% tax on the gross revenues of all employees for any employer that does not provide health insurance. Mm-hmm. So they have to pay that to pay for the public option. In addition to that, if any individual does not buy a health insurance policy, they have to pay a penalty of 2.5% of their gross income to the government to help pay for it. And yet, despite all of that, it's still not enough money to pay for this health care program. So we already have an $11 trillion federal debt. We anticipate it's going to be $23 trillion. And when President Obama and Nancy Pelosi talked about the need for this legislation, they said one of the reasons that they needed it was that we cannot sustain the cost of the existing system. Mm-hmm. And yet the Congressional Budget Office says that their proposal will cost more than the existing system.
Well, obviously, you have your reasons for not liking that. I know you have said that you do feel there needs to be change in the insurance industry.
Absolutely.
Maybe we can get started on it. We'll take a break. But what do you see as the alternatives to what you're not for presently?
Well, for example, we were disappointed that the Speaker was not really willing to negotiate with us because, for example, I agree that we need to get rid of the pre-existing condition. Mm-hmm. Insurance companies can deny you if you have a pre-existing condition, and there's nothing you can do about that. And even the insurance companies have indicated, we'll go along with that. And we had agreed with that. In addition to that, we had 12 amendments adopted with Democratic support and Republican support in the committee that this bill came out of. And then when they took it to the floor, Nancy Pelosi stripped out every one of those amendments that were agreed to by the Republicans, removed all of them. And things that I'm talking about are if you're an employer and you provide health insurance for your employees, you get a tax deduction. Mm-hmm. But if you're an individual and you buy a health insurance policy, you do not get a tax deduction. That's one thing. Number two, if you want to buy health insurance here in Kentucky, you should have the ability to look around the country, explore all policies, and pick the one that's best for you in a price range that you feel comfortable with. But under existing law, you can only buy from insurance companies in Kentucky that meet the requirements here. So in order to bring competition into the insurance business to help lower costs, we wanted to open it up for a national marketplace. They would not go along with that.
Let me take a break here real quick, and we'll be right back. Don't lose your thought, and we'll come right back and talk. We're talking 1st District Congressman Ed Whitfield, and we're talking about health care and more. We'll be right back.